And we've got a lot to do to get where we need to go with regard to that. We really believe it's time for mental health. We now understand that people, even with the most severe mental illnesses, if given the kind of appropriate science-based care that we understand, we've got a long way to go to close this gap between what we know and what we do, but we understand that people, even with the most severe mental illnesses, can and will recover. And the more socially inclusive and rehabilitative our orientation is, the earlier we can get to people in the course of their illness before their neural damage occurs and disability sets in, social disenfranchisement, the sooner they'll be able to recover. It's time for mental health. We know this as a fact. Recovery is now our expectation. It's time for mental health in the schools. We have known for decades now that there's a 10-year gap between people who ultimately will have a mental health diagnosis having their first episode of illness, meeting criteria for the first time. A 10-year gap between that occurring and those persons receiving services. And we used to think that these were disorders of young adulthood and would be typified by people, particularly when they launched their life into college or into the work environment after high school. We understand that these are developmental disorders that occur with half of diagnosis occurring by the time people are 14 years old. So between 14 and 24, people are episodically ill, don't get the kind of care that they need. So it's time for mental health. It's time for us to close that gap. We just received a report last Friday from the Institute of Medicine that summarizes the state of science in terms of prevention and promotion. And one of the things that is in that report is a call for more effective screening with effective follow-up to get people the services that they need. It's time for mental health. It's time for us as an advocacy community to assure that people get their social and emotional health checkup just the same way. We check their eyes and their ears to see if their spine is disturbed, make sure people have their vaccinations. It's time for mental health. You know, we've known now for several years that the largest psychiatric institutions in this country are our penal system. That we estimate that, you know, in the prisons, number one, we as a community should be concerned and outraged that we incarcerate more people in the United States than any country in the world, period. But in our prisons, there are about 320,000 people with severe mental illnesses, and that doesn't count addictions. If you counted the addictive disorders, you'd be up to 70 or 80% of the prison population. We know that people who are in prison can have an extraordinarily difficult time, and they're not a desirable inmate from the prison's perspective because of the risks and liabilities associated with them. We know we have 320,000 people there, and only about 40,000 people served in our state public systems. Not that we should have 320,000 people in the state public systems, but it's time for mental health. It's time for us to do something about getting those people out of those prisons. California is currently, it looks as though California is a very interesting state right now. They've got their legislature locked up. So that's, you know, there may be a new strategy here. I'm not sure. But California is a very interesting state in that there are about 100% over census in their prisons. You know, they I think have 150,000 people in the prisons, and their census should be about 80,000 to be at full capacity. And it looks as though there's going to be a bit of court order demanding that they start to release people from prisons. And the example that was in the paper in the Times about this was a person who had 0.03 grams of methamphetamine, but it was his third felony. And they got 3 strikes and you're out rule. And so he got a life sentence for possessing 0.03 grams of cocaine. It's time for sensible public policy. It's time for sensible policy about the treatment of mental and addictive disorders. So it's definitely time for mental health. We now know that in order to control costs in terms of our healthcare system in this nation, we have to deal with chronic illnesses. 75% of all expenditures for healthcare are for chronic illnesses. We also now know that the most chronic illnesses, the most disabling illnesses, the illnesses with the greatest burden in terms of the overall disease burden are the mental and addictive disorders. And the WHO estimates that 30% of all disability is related to mental and addictive disorders, and that's contrasted with about 15% for cardiovascular disease, about 12% for cancer. So you get a sense about the severity of these illnesses, and we know much, much more than we do. So it's time for mental health. It's time for us in this new progressive era. Beers was involved at the time of Roosevelt and the last progressive era in this country. We now have a new progressive era. It's time for mental health to enter into the mainstream discussion of healthcare reform, to no longer be a segregated, separate system of care for those people. It's time for mental health to enter into the mainstream and be part of health.